Okay, so my name is Dwayne Campbell. I'm a physical therapist, and my daily routine or job responsibility is designing and implementing rehabilitation programs for people who are injured. In addition to that, I help with um, designing training for athletes so that they avoid injuries. Um, Education and experience. Well, I attended the University of the West Indies School of Physical Therapy. That's a 3-year degree program, and then there's a 1-year internship. I've been a physical therapist for the past 15 years, and the majority of that has been spent in sports rehab. Um, yeah, so I deal with a lot of people, I deal with mostly with athletes. Yes, there is some pressure and anxiety to give them the results that they're looking for, um, particularly with athletes. When an athlete becomes injured, it's very very demotivating for them. It's like an athlete with an injury is almost comparable to somebody who gets like a spinal cord injury or a stroke, because they work so hard to put and push their body every single day to try and achieve these fantastic results, um, and then they're not able to train or train properly for a number of weeks, and it for them I think it's about as depressing as somebody who's gotten like a stroke, or somebody who's gotten like a spinal cord injury. And that puts a lot of pressure on the therapist, because you want to get them a full recovery, and you want to get them a speedy recovery. Um, and sometimes they're conflicting. Sometimes those become conflicting goals. So yeah, it does become stressful at times. How do I deal with the daily stress and anxiety? Um, wow, that it. I don't feel that much stress and anxiety anymore. I think it was a lot harder for me when I was a young therapist. Um, there is still some anxiety, but it's not. I guess what I'm trying to say is, as you get a little bit more experience, that reduces a lot. Um, my coping strategies include music and photography. Those are two creative outlets for me that help me to contain my stress levels, and keep it at a minimum. Oh, okay, yeah. As a physical therapist, you can't always give your patients the results that they're looking for. Um, and that is actually quite true. Physical therapy is still an evolving profession. We're still improving treatment techniques and different strategies at getting people to recover fuller, recover quicker. Um, so it, it's it's one of those things that I knew coming into this profession, that we wouldn't be able to solve every single problem all the time. Um, and it was explained to us during training as well that it we're not always going to be able to solve everybody's problems. But one of the strategies I use is by constantly re-evaluating, the patient's progress, and if I don't see the patient progressing as I believe they should be, then I will go back to um, looking through different peer review journals and different treatment techniques to see if there's anything I could add to the treatment program in order to get them to continue moving along. But one of the things is to just continually reassess what you're doing, continually reassess the patient's progress relative to what you're doing with the patient, and to show them, where they're coming from and what they've achieved to date, and just that constant dialogue with the patient to see, to show them what's going on and keep them involved, and also to keep them involved with in terms of helping to choose what treatment they prefer, because sometimes there are options in terms of one type of treatment versus another, and just a constant reevaluation. I think if you measure it, you can improve it, and the fact that we're measuring all these different variables that have to do with the treatment protocol and the patient's response to the treatment, that in itself helps to relieve a lot of the anxiety once they can see that they're continually progressing, and they can see, when the progress is slowing down. That kind of helps to prepare them, for, and it prepares them for some of the things that, some of what they're gonna feel in terms of, when they're not seeing the progress that they want. And also for me as a therapist, helps me to prepare for the point when I have to discharge them because they're just not progressing anymore, or send them back to the referring doctor, the orthopedic or whoever referred them for physical therapy, for them to do some other kind of intervention. So yeah, it's communication that helps get through that particular nuance in physical therapy. Is there anything? Immediate results. The pressure to give them immediate results. Initially, when I was a younger therapist, I felt that pressure for immediate results. And it kind of went away a little bit because, when you're young, you know a lot of the theoretic stuff, but you haven't applied it enough times to see, what type of reaction to expect, but as you gain more experience, or as I gained more experience, I started realizing, okay, well, with this type of patient, with this kind of injury, or this stage in their injury rehab, I expect them to move from this stage to that stage within this amount of treatments, or this or 3 weeks or whatever. So it went away as I got more experience, but then it kind of came back a little bit, because at this point people are very they want immediate results. Everybody wants something really quick, and people, I think, the whole attention span and their whole I guess I call it the 21st century lifestyle is very fast paced, and people expect immediate results all the time. What I do to kind of deal with that is I try to give my patients a little bit extra, a little additional service, a little bit extra in terms of what I try to see what else could I do at this point to see how I could get them some additional relief from their symptoms while I go at addressing the root cause of their problem. And we have a lot of different modalities that can relieve pain and reduce swelling, edema. So I try to do a little bit extra in terms of treatment to see how I can give them some immediate, tangible relief from their discomfort while I work on their overall rehab program.